Hey everyone, this is Peter with Physical Therapy TV. In this short video today I wanted to share some information regarding manual testing for rotator cuff tears. If you are having shoulder pain or if you are suspecting yourself from possibly having a rotator cuff tear, I wanted to share some manual tests that a physical therapist or your orthopedic doctor might do to test your rotator cuff muscles and determine if you possibly have rotator cuff pathology or a possible rotator cuff tear. So the first one up here is a test for your subscapularis muscle. Now your subscapularis is your only internal rotator of your shoulder, not the only internal rotator of your shoulder, but the only rotator cuff muscle that is responsible for internal rotating your shoulder. And the first test we're going to go ahead and review is called the lift-off test. I'm going to read this out and sort of demonstrate on the picture if you'll allow me to. The examiner assists the patient to get in a position where he touches their lower back with the arm fully extended and internally rotated. So your arm or your humerus is fully extended and your arm is internally rotated. So test is positive if you're unable to lift your hand off your back. So your hand is up against your back and you're trying to lift the hand away from your upper body. So if you're unable to do that, this indicates weakness of the subscapularis. So something's going on there that could be leading to the weakness of that muscle. The second test for your subscapularis is the passive lift-off lag sign. So what the doctor might do is your arm will be extended, and internally rotated. Your hand will be positioned on your back. He'll go ahead and lift the arm up and away from your body and ask you to maintain that position. If you're unable to do that, it takes quite a little bit of a strength. If you're unable to do that, probably most likely you have subscapularis weakness, which could be attributed to a tear. So the third test for subscapularis is your belly press test. In this test, the doctor might just instruct you to place your hand flat on your abdomen and to keep your arm in an internally rotated position. They say that this test is normal when your elbow doesn't drop backwards as you're trying to squeeze. So you want to you need to be able to keep your elbow forward as you're exerting pressure on your abdomen. If you're unable to do that because of weakness or a tear, your elbow is going to drop back. So here you can see the hands positioned on the abdomen. This person needs to keep their elbow in this position or even a little bit more forward. You're pushing down into your abdomen. If your elbow drops backwards, this is indicating weakness in the subscapularis muscle. We're going to go ahead and move on to the special test for supraspinatus and infraspinatus. So the external rotation lag sign at 90 degrees or drop sign. In this position, the patient is seated with his or her back to the physician, who holds the affected arm at 90 degrees of elevation and at almost full external rotation, and with your elbow flexed at 90 degrees. In this position, the maintenance of the position of external rotation of the shoulder is a function mainly of your infraspinatus muscle. So the patient is asked to actively maintain this position as the physician releases your wrist supporting the elbow. This sign is positive if there's a lag or a drop that occurs. So you can see in this image right here, the doctor is going to go ahead and externally rotate your arm or keep it in a fairly neutral position. You've got 90 degrees in your elbow, you've got 30 degrees of elevation of your arm, and the entire upper arm is kept in your scapular plane, or the same diagonal direction as position of your scapula. So in this position, he's going to go ahead and support underneath the elbow and also underneath the wrist, and he's going to go ahead and just let go with your hand while your arm is in that position. If your arm drops down, that could be indication of a tear or some pathology going on. Again, here's another image of it. The arm is basically supported underneath the elbow with the arm externally rotated, and if you're unable to hold that position when he lets go, indication of a tear weakness. So Job's test, or the empty can test, in this test you're first assessing the deltoid with the arm at 90 degrees of abduction. So this is 90 degrees of abduction right here. Your arm is kept in a neutral position, so it's not internally or externally rotated. The shoulder is then internally rotated and angled forward at 30 degrees. So the arm is brought forward, or the upper arm is rotated down towards the floor. The thumb should be pointing towards the floor, and then manual testing against resistance is performed with the examiner pushing down. So the doctor is going to go ahead and move your upper arm down towards the floor, pushing down. And this test is regarded as positive while your upper arm is kept at 90 degrees. This test is regarded as positive when there's weakness to resistance. So if you're while you're keeping your arm at 90 degrees of abduction and he's pushing down on your forearm towards the floor, if you're unable to resist him with a strong measure compared to the other arm, most likely you have some pathology going on with the rotator cuff muscle there. So again, testing the supraspinatus muscle. For this, there's the drop arm test. And basically what you do here is you abduct the arm to about 180 degrees, and then observing the patient slowly lowering the arm down to the waist. The test is positive when the arm drops to the side. So you're basically just lifting your arm up overhead with your arm next to your head, and you're asking the person just to slowly lower the arm down to the floor. The patient may be able to lower the arm slowly to 90 degrees because this is function mostly of your deltoid, but after that it's mostly your supraspinatus. And again, if you have a tear or weakness when your arm reaches about 90 degrees, if there's a drop, most likely you have supraspinatus tear. So test for Teres Minor, the hornblower sign. This test, the examiner supports the arm at 90 degrees of abduction, and in the scapular plane with the elbow flexed at 90 degrees. The patient then attempts external rotation of the forearm against resistance. So you're basically trying to push your forearm into the hand of this person. If the patient cannot externally rotate while your arm is in this upper arm is in this position, you assume the position of a hornblower. So basically, as you're pushing out and you're unable to do that, especially compared to the other side, most likely an indication of a Teres Minor rotator cuff tear, which is much less common as a supraspinatus tear. So if you have biceps tendon issues, tests that can be done for assessing your biceps tendon is, the first one's a speeds test. So the patient's asked to flex his shoulder against resistance while the elbow is extended and the forearm supinated. So the test is positive when pain is localized to the bicipital groove for the biceps tendon. So your arm is in a supinated position. You're going to go ahead and elevate your arm to about 90 degrees. The doctor is going to stabilize your shoulder blade, and he's going to perform resistance against your forearm as you're moving your arm up and down. If you feel pain right here up in the bicipital groove, most likely you have some biceps tendonitis or biceps tendon pathology, or even could be an impingement of your biceps tendon. So near sign is an impingement test, and the impingement sign is elicited with the patient seated and the examiner standing. Scapular rotation is prevented, so the doctor stabilizing you're pushing down on your upper shoulder area to stabilize your scapula, while the other hand raises the arm in forward force flexion, causing the greater tuberosity to impinge against the acromion and most likely the rotator cuff muscle. So the doctor is basically going to go ahead and press down on your shoulder with his one hand, and with your other arm forcefully kept in internal rotation, he's going to go ahead and lift the upper arm up while pressing down. If you feel pain in your shoulder joint, could be a sign of impingement. So those are the basic tests, manual tests that you'll find. doctors performing. If you need more help or tips on getting shoulder relief, dealing with rotator cuff impingement or tendonitis, we have some free information over at Physical Therapy TV. Go ahead and click on the free reports and go ahead and request some free information I've put together as far as eliminating rotator cuff and shoulder pain. Sorry for the long video. I hope it was helpful, and we stumbled through it together. I appreciate it. Take care, and if you have any questions, feel free to leave a comments. I'll be happy to help in any way I can. Take care.